36-year-old Maina Kaibera knows all too well the pain and agony of a cardiac patient in Kenya. It all started in the year 2002 when he was still in high school. He would experience night sweats and intense coughing. When schools closed for the April holiday, he went for a medical checkup where he was diagnosed with pneumonia.
So I take medication for pneumonia, 3, 4, 5 days, no changes, and you go back. The cardiologist says you have a growth in your heart. So basically all these things I was having, coughing at night, sweating, fatigue. He says, cardiologist says you have a growth in the heart and you need to be operated on soonest possible.
It was a bombshell that shook him and his entire family. His family quickly organized for him to have an open heart surgery to remove the growth in his heart. By then, he was a candidate that was supposed to sit for his KCSE exams.
So they open up my chest, but then they discover something very shocking. From the first operation, they scar the heart because the chest is opened up, the sternum, then the heart is cut up, they access the valve, stitch. So when the scar of the heart was healing, it attached the sternum. So they healed as one, and the heart is supposed to be separate from the sternum. So that the risk of me bleeding was too high to death. So they basically aborted the operation. So closed me up, took me to ICU for recovery, and then 2 days later I'm told the operation was not successful.
Going back to school, he says, was another blunder since he had not taken much time to rest. Unfortunately, towards the end of the year, Maina started exhibiting the same symptoms of fatigue, throwing up, as well as loss of appetite. He had to be rushed to the hospital for review. The whole year of 2006, Maina was in and out of hospital with no improvement.
So finally they discover that there is a leak in the prosthetic valve that was inserted after they took the growth. Because the valve is put, then is stitched on the heart. So apparently one of the sides had come off, so blood was actually leaking as opposed to passing through the valve, was passing on the side, and what was causing all these complications. So doctor's opinion, go back for a redo, open heart, to repair the leakage.
For the second time, he underwent an open heart surgery. However, the process was not complete as something else was discovered.
So they open up my chest, but then they discover something very shocking. From the first operation, the scar of the heart, because the chest is opened up, the sternum, then the heart is cut up, they access the valve, stitch. So when the scar of the heart was healing, it attached the sternum. So they healed as one, and the heart is supposed to be separate from the sternum. So that the risk of me bleeding was too high to death. So they basically aborted the operation. So closed me up, took me to ICU for recovery, and then 2 days later I'm told the operation was not successful.
He had to embark on a journey to India for a third open heart surgery to replace the leaking prosthetic valve. Approximately 4 weeks later, he came back to Kenya, fit to continue with his life, albeit on strict medical checkups and reviews. With the rising cases of lifestyle diseases in the country, experts now say that 1 out of 4 Kenyans suffer from a cardiovascular disease without their knowledge. Dr. Eubrin Mora, who is a cardiologist, says that many Kenyans die of cardiac-related diseases due to late diagnosis and lack of enough cardiogram machines in the country.
These diseases can either be ranging from diabetes that affects the heart and affects the vessels. It can be high blood pressure, which affects the vessels and affects the heart. It can be renal diseases or kidney diseases that affect the vessels and affect the heart. You can also have some endocrine diseases, which means hormonal diseases, which also release chemicals that affect the vessels and affect the heart.
Cardiovascular diseases are a second leading cause of mortality in Kenya after communicable ailments.
Last 2 years that we've had our screening, the statistics are very shocking. You'll be very surprised, Diana, that up to 25% of Kenyans have an elevated blood pressure. And you know, if Kenya is 50 million, so we're talking about 12.5 million Kenyans. That's a very big number, and people don't know. And even the ones that are known and they're on treatment, up to 75% are not optimally controlled.
After the successful third surgery, Maina joined Jomo Kenyatta University of Agriculture and Technology in 2005 to pursue landscaping. Again in 2013, he had a relapse.
I had open operation, and by virtue of the fact how this is your 4th time, it would not be advisable to do it locally. So where do you go? They say back to India.
The journey has not been easy for Maina, but luckily for him, his family and close friends have walked with him throughout the journey. The father of one now leads a quality life.
His condition was very new to me. I had never encountered anyone with such a condition. So it was hard at first, but by and by I got to understand what it entailed, at least the small details and what is expected generally when it comes to like his diet, activity, what level of activity he can engage in. Yeah, and then with time I realized he can live just like many other people.
According to Dr. Yubri Mora, many Kenyans rush to hospital when they are in critical condition, when in most cases, the heart keeps talking to them by sending symptom signals.
You find heart failure patient who sleeps standing because they can't lie down.
Emerging challenges such as COVID-19 have shown the need for continuity and action in tackling communicable diseases.
And this chest pain is felt on the left side of the chest where the heart is. A few people have their heart on the right side, but yes, most people have their heart on the left side, and this pain radiates to the left arm or to the jaw. Yeah, and someone will tell you that when that happened, when they had that chest pain, they felt like they were breathless. They had shortness of breath, or they were sweating a lot, or they had nausea. The other thing is that they'll have lower limb swelling. Their legs tend to swell and become, because of the fluid retention. And then you'll notice that these people even become puffy. Their faces they just swell up because the fluid is being retained.
This has been highlighted by report linking hypertension, cardiovascular diseases, or other risk factors such as obesity, smoking and physical inactivity, with a greater risk of being severely impacted by COVID-19. Dana Rose, K24 for the Health Beat.